When dengue spreads widely, the impact extends beyond individual patients. Hospitals become overcrowded, medical staff work under intense pressure, and blood banks face increased demand for platelet donations. Schools report absenteeism, parents have to miss work to care for their children, entire neighborhoods feel the strain. In regions where healthcare resources are already limited, outbreaks can stretch systems to their limits, just like in Pakistan. And yet, despite the scale of its impact, dengue often remains underestimated, dismissed as just another seasonal illness. But the numbers tell a different story. Each outbreak leaves behind not only medical records but emotional scars and economic consequences. Recognizing these patterns, we decided to distribute information about awareness and prevention to reduce risk within our own community. Our primary course of action to addressing the lack of awareness about dengue and its methods of prevention was an educational seminar hosted in our own school, featuring a medical professional, Dr. Guljana Shahzad. In this seminar, we introduced our audience to dengue and explained the severity of it to them, as well as showing them statistics to make them realize the impact of the issue. At the end of our demonstration, we showed them an emotional video showcasing the life of dengue patients. We also distributed bilingual packets of information directly from the website of the Government of Punjab in both English and Urdu to make sure the information wasn't restricted by language. Our medical professional explained some frequently asked questions about dengue, as well as hosting a question and answer session with the audience about any questions they had regarding dengue. We also did community surveys, through which we assessed public understanding and identified common misconceptions, particularly regarding breeding sites and early warning signs, as well as preventative measures. To supplement this, we also posted up informative posters in classrooms. Through these surveys, we found out that the majority of people didn't even know what kind of insects spread dengue, let alone knew about dengue fever in general. A lot of people didn't know something really important, which is that dengue is a transferable disease as well, and you can see this information on the pie charts on the screen. Moreover, using these surveys, we were able to gauge the effect of our educational seminar. As you can see on the screen, the pie charts show that awareness went up by a lot after our educational seminar, as these are the results of our post survey. We also contributed to environmental efforts by planting mosquito repellent trees in our own school, as well as getting another school outside of our community to do fumigation and spraying of mosquito repellent spray within their own school. We also utilize social media to extend our influence and make sure our message and our advocacy got to as many people as possible. Every year, as temperatures rise and the monsoon season approaches, a familiar but underestimated threat begins to spread across our city. It doesn't arrive with sirens or warning signs, it doesn't shake buildings or darken the sky. Instead, it arrives quietly, carried by a mosquito small enough to escape our attention, yet dangerous enough to overwhelm entire hospitals. Dengue isn't dramatic at first. It begins with what feels like a normal fever, a small headache, fatigue, something easy to ignore. But what starts as discomfort can quickly escalate into something far worse. Dengue is caused by a virus transmitted by the Aedes aegypti mosquito, a species easily identified by the white markings on its legs. Unlike many other mosquitoes, it bites during the daytime, increasing the chances of unnoticed exposure. Even more concerning is where it breeds. The mosquito doesn't require dirty swamps or marshes, it thrives in clean, stagnant water, as little as a bottle cap's worth. An uncovered rooftop tank, maybe even a forgotten bucket after rain. The conditions for an outbreak are often created not by disaster but by neglect. For thousands of families, dengue is a sight of a child burning with fever that refuses to drop. It's the anxiety in a mother's eyes as doctors monitor platelet counts hour after hour. It's the uncertainty of waiting outside a hospital room, hoping that the condition doesn't worsen overnight. Severe dengue can cause intense joint and muscle pain, persistent vomiting, and dangerously low platelet levels. In critical cases, it can lead to internal bleeding and even organ complications. What makes dengue especially frightening is how quickly it can progress. A patient who appears stable in the morning may require urgent care by evening. The emotional toll on families is immense. Fear, exhaustion, financial strain, all triggered by something that could have been prevented. Dengue remains a serious public health challenge in many regions, but it isn't an unstoppable force. It's a disease shaped by environment, awareness, and human behavior. Understanding it is the first step, addressing it responsibly is the next, and through informed action and community engagement, its impact can be significantly reduced.